I mentioned osteoarthritis, gouty arthritis, and septic arthritis. Now, the osteoarthritis, that one just occurred as you are just aging and as a result of overuse of a particular joint. Yeah. Then, gouty arthritis is just as a result of what you've been taking. Like, if you are like this vessel that take heavy steroids, yeah, steroids, uh, and also meat, excessive meat.
Hello guys, once again welcome back to my channel and also welcome back to Health Talk with a medical student. So today we'll be talking about arthritis, and by the grace of God I still have Mr. Prince here with me. Mr. Prince, today we are talking about arthritis. I don't want to go further. What is arthritis?
Arthritis is an inflammatory condition that affects the joint and it's characterized by pain, swelling, and warmth. Yeah, then also the very major thing you'll notice is joint stiffness. Yes, it will be difficult for you to move your joint.
So do you mean arthritis only affects the joint of
Yes, it only affects the joint. It can affect a single joint or multiple joints.
yeah. Oh, yeah. So what are the causes of an arthritis?
Um, okay. I think before we even go to the causes, we talk on the type because the causes will also tell us about the different types. For uh, okay, first we have osteoarthritis, which is the most common one. That one affects um elderly people, and it occurs as a result of excessive use of that particular joint. So commonly excessive use, like let's say you are this person that sprint and runs right here. Every morning wake up you run, when you wake up you run. So that's joint on your leg, yes, or the joint in your hips. With age, as you get older, yes, it will start degenerating, like you start having those symptoms of arthritis. So I can now tell you that one of the causes, or should I say, like I would say, risk factors of arthritis is age. So as long as you are getting older, your age is going to be a major concern when it comes to arthritis. Let's say you do all kind of activity that you do, maybe you're a carpenter, you're always hammering, all your life, that's your major work. So as you get older, your risk, you start having that symptom towards, when you're getting older. So age is a major factor. Then also use of steroids, some of the drugs like people you are used to, like are exposed to, can now lead to this other type of arthritis called gouty arthritis. That is deposition of crystals in the joint, and the joint itself goes to affect it, your MCP, metacarpopharyngeal joint. So it goes and deposits there, and you'll be having pain in early morning of the
and where are these joints found?
okay, like now this joint I just mentioned is found in your big toe, on your foot. So yes, um, other joints like no, okay, I from the physiology I should have mentioned the components of the joint. One of the things you have there is the synovial fleet. That synovial fleet, as far as there's an inflammation, there may be bacterial inflammation. So that's another cause, and which you now have what we call septic arthritis. But within the different types of arthritis, I mentioned osteoarthritis, gouty arthritis, septic arthritis. And so the septic arthritis is as a result of bacterial inflammation, Streptococcus species and Staphylococcus aureus. Those are what affect that. So you all of them come with the same symptoms, but they are different causes. You understand? Then also family history. If you have a family history of, like, family history is a risk factor for almost every disease. As far as a member of your family has been faced with that condition, then there's a high chance that you will face that condition too. So
So are you saying that people who do carpentry work or athletes they shouldn't do that even because of the risk factor of arthritis?
now waiting they give them money, so what they want. But the thing is, you can, while doing it, you can do some protective, like, okay, for instance, I think I'll go to those people, but now I know those people that do this typing. They type a lot. Yeah, you can use some protective wear like that protect your carpal, toenail energy. So and also you need to know how you are,
How regular?
how regular, yeah, the control, yeah, and all that. But really, I cannot advise that you will stop the work. Yeah, that's what it's giving you. So and we continue with that.
But yes, based on all the tools you've mentioned, how can someone know that he or she has arthritis? Okay, the symptoms of arthritis.
Well, heard the joint stiffness, the joint stiffness.
Did that you won't be able to move?
Yes, yes, yes. Some of them, especially early hours of the point, for an hour, you will not be able to move your body. Yeah, but um, there's it improves with increased activity.
Mhm.
Yeah, it improves with increased activity. There was something I didn't mention, like now rheumatoid arthritis. Rheumatoid arthritis includes with increased activity. Rheumatoid arthritis is an autoimmune. That means the body immune system attack the joints. See, so but with time, like let's just say you wake up in the morning for an hour, you'll be having this um fitness. But when you started engaging in your daily activities, the pain starts to reduce. So one of the symptoms is pain. There's also swelling. There's also warm. The joint area there will be warm. Then also there is joint stiffness. So those are four cardinal signs and symptoms that have arthritis. Yes.
So, what are the ways we can manage this arthritis?
First, you present to the hospital for a proper history taking. They take the history, the progression of how it has been, because you might end up explaining to a doctor and turns out that it is not arthritis. Okay, so proper history taking, then the investigations, then the treatment. The treatment can include some antibiotics if it is um a septic arthritis. You understand? Now, if it is a gouty arthritis, meaning that deposition of uric acid in your system, they can give you drugs that can help expel that uric acid from your body. Example of those drugs, I know I'm not meant to, but I was just calling it allopurinol. Yeah, so drugs that can help to expel the, yeah. So what else again? Yeah, then you can use other management techniques like forgetting the name, but for typing practice, yes, they can use it to reduce the number of times they select their ways while typing. Yeah.
What about exercise?
Yes, exercise is really something that it depends, but physiotherapy, yes, it's one major physiotherapy exercise, but the exercise should be actually be over, how I call it, overseen by a physiotherapist, because there's some exercise that you'll be doing and you'll be adding, because normally if it is for osteoarthritis that is a result of excessive use of a particular joint, then why would you be carrying out an exercise that will be putting more on the joint? So let it be carried out by a physiotherapist who will know that okay, you don't do this particular type, you don't do, so that's and that. Then lastly, follow up. Yeah, follow up is very, very important. After treatment, from the activity taking, the investigation, the treatment, follow up. You don't just take the drugs and that's all. You constantly come to the hospital for review of your medication and the progression there.
So, if this inflammation persists, what are the complications? What might be the outcome?
One major complication is if there is you are not able to move as per the stiffness, the pain, and you just sit like a sedentary lifestyle, you can start having swelling, and that swelling can lead to what they call DVT. DVT means deep vein thrombosis. Yes. As a result of that deep vein thrombosis, then you can think of a lot of other complications that can occur. And one major complication is stroke. When there is that embolism to any of the arteries that take blood to the brain, so they will have that. So stroke is a major complication that can result as a um um the arthritis, poor management of the arthritis. So, yeah. And aside that, normally your general life, this thing, quality of life will be reduced. So you probably won't be able to go to work, school, and do stuff.
So in summary, can you give us the difference between the three types of arthritis you mentioned?
Okay. I mentioned osteoarthritis, gouty arthritis, and septic arthritis. Now, the osteoarthritis, that one just occurred as you are just aging, and as a result of overuse of a particular joint. Yeah. Then, the gouty arthritis is just as a result of what you've been taking. Like if you are like this wrestler that take heavy steroids, yeah, steroids, uh, and also meat, excessive meat, like me with the always stuff. Like so, yeah, meat too. It's a real cause of gouty arthritis as you down to it as you age, but like I said, if you know, like if you are eating meat now, it happens to you now as a result of eating, yeah, with time. That's why you have to change the kind of meat you even eat as you are eating. No longer eat red meat, you are going to eat white meat. So, then last is septic arthritis, bacterial infection. Bacteria, you have from normal injury, fall, jaw, then the bacteria can do it with the joint, and the synovial fluid there is affected. And yeah. Sure.
I think we'll stop here for today. Mr. Prince, thank you for having you. And please don't forget to like, share, and subscribe. See you again in my next video. Thank you.